Hello, my name is Amber Eck and I will be showing you how to measure blood pressure. Patients should refrain from smoking cigarettes or ingesting caffeine for at least 30 minutes preceding the measurement. Patients should be seated quietly for at least 5 minutes prior to taking their blood pressure. Their feet should be flat on the floor without being crossed, back supported by the chair, and their left arm should be placed at heart level. The next thing I will be showing you is the blood pressure cuff, and it is what you wrap around the patient's arm. The appropriate cuff size should be used to ensure accurate measurement. To ensure the appropriate cuff size is chosen, there are markers inside the bladder that show if a larger or smaller cuff size is needed. The bladder within the cuff should encircle at least 80% of the patient's upper arm. This is the inflation bulb or pump that pumps air into the cuff when you squeeze it. The calibrated manometer gauge shows you how much air or pressure is inside the cuff in millimeters of mercury. There is a line on the blood pressure cuff which should be placed near the patient's bronchial artery. Before putting the cuff on, you should palpate the area of the bronchial artery and try to find a light pulse. The cuff should be firmly wrapped around the patient's upper arm. Make sure it is placed on bare skin and no clothing gets in the way. You should be able to place 2 fingers inside the cuff. If you cannot do this, it is too tight and can give an inaccurate reading of blood pressure. This is a stethoscope. The 2 earpieces at the top are called prongs and the thing at the bottom is called a diaphragm. This is what you use to hear the Korotikoff sounds, which I will explain a little later on. When you put the prongs in your ears, make sure they are facing forwards and double check to make sure it is on by twisting the diaphragm and tapping on it. There should be a louder noise when you tap on the diaphragm when the stethoscope is on. You can place the calibrated manometer gauge onto the blood pressure cuff or leave it on a table, whichever is easier for you to use. Before pumping air into the cuff, make sure to turn the valve all the way to the right, but not to the point where it's too tight because that can give you trouble loosening it later on. This allows air to be pumped into the cuff. To release air, you slowly turn the valve to the left. I like to say righty-tighty, lefty-loosey to remember this. The stethoscope diaphragm should be placed below the antecubital space over the bronchial artery. I am palpating the area where her artery is one more time to ensure I have the cuff in the right area and can feel a light pulse. The cuff pressure should be quickly inflated by squeezing the pump to around 20 millimeters of mercury above the first Korotikoff sound, or to 200 millimeters of mercury if you do not know the patient's blood pressure. Since I've taken her blood pressure before, I will inflate the cuff to around 160 millimeters of mercury. Pressure should be released slowly at a rate equal to 2 to 5 millimeters of mercury per second. Korotikoff sounds are blood flow sounds observed while taking blood pressure. You should be listening for a thump noise, and whatever number you hear, the first thump noise on will be your systolic blood pressure. Systolic blood pressure is the point at which the first Korotikoff sound is heard. Diastolic blood pressure is the point before the disappearance of Korotikoff sounds, or the disappearance of the thump noise. Whatever number you hear that last noise on will be your diastolic blood pressure. The blood pressure I recorded for my patient was 120/70. According to the blood pressure I recorded for my patient, she is considered prehypertension since her systolic blood pressure is at 120. At least 2 measurements should be taken a minimum of 1 minute apart, and the average should be taken of those 2 measurements. Before taking the next measurement, make sure to let the person's arm rest and take off the cuff. Here is the table of the classification and management of blood pressure for adults. Thank you for watching this video on blood pressure assessment.